Hello, everyone, and welcome to this episode of CRATV, where we talk about politics, policy, and people here in the great state of California from a conservative perspective. I am your host, Craig DeLuz. Please take a moment, if you haven't already done so, please make it a point to like and share this program, as well as subscribe to our YouTube channel and follow us on Facebook. And in both cases, make sure that you hit the notification button so that you can get the alerts as soon as we go live. You can participate in the live chat as the program is going on. Before we get started into today's program, want to let you guys know about a couple of updates. First and foremost, want to let you know this weekend was supposed to be the CRA annual convention. Unfortunately, due to concerns relating to COVID-19, the event has been canceled, or at least postponed. So if you follow up on our website, cragop.org, that's cragop.org, we'll be able to let you know when the event is going to be rescheduled. So just once again, want to let you guys know that. So if you were planning on visiting us in Visalia this weekend, we're not going to be there. So just so you know. Also, we have an article that we just put up. We here at the California Republican Assembly, we endorse candidates whose values are consistent with those of the party and those of us as conservatives. So we had a number of successes in the March election. So for those who are either moving on to the general election or who won outright, we'd like you to know who those candidates are so that you can come out and you can support them as they take their elections either to the fall election or as they prepare themselves to take office. So once again, just follow the link in the description of this video and you can go and you can check out all of the election results for CRA supported candidates. All right, let's get into today's topic. I'm sure as many of you, I'm sure many of you like myself, are following closely what is going on with the COVID-19 outbreak and what's going on a worldwide scale. If you're like me, there's many things and many decisions and many things that are happening that really have kind of got you perplexed. At one point you had people saying, well, this is a lot like the flu, and it's, most people aren't in danger of being actually this isn't fatal for most people should they contract it. At the same time, you also have people saying this is the worst pandemic that we've ever seen. I mean, the reality is there's a lot of information that is out there, and not all of it is accurate. And unfortunately, a lot of that information is adding to a lot or creating a lot of hysteria. Hysteria that my concern is going to have an impact far beyond the virus, what the virus will actually have. A good friend of CRA, a good conservative writer who is the editor-in-chief for the California Globe, wrote a piece on it over the weekend, and I just wanted to have her on to kind of talk a little bit about her piece and what she's seen going on here in the state of California and even nationally, to kind of give us all a little perspective. So with that, I'd like to welcome Katy Grimes of the California Globe. Katy, welcome to the program.
Thank you, Craig.
Hey, all right, so over the weekend you wrote a piece regarding or addressing kind of the governor and the state of California's response to COVID-19. And I just wanted you to kind of share your perspective with our viewers real quick.
Well, what I've been trying to do is take a look at the numbers. I'm not diminishing at all the importance and the seriousness of this virus. It's a dangerous flu virus. It's deadly for some. But one of the things that I've noticed is we haven't heard a darn thing about the 18,000 people who are already dead in the U.S. from the seasonal flu. And our media and now politicians are really making hay out of the COVID-19 virus when there's, I think today's numbers are maybe we're up 45 dead or over 50. Again, not diminishing that, but they're crashing the economy right now. And, we've got a governor who's ordered people over 65 to stay home, and he's closing down bars, brew pubs, wineries, and telling restaurants you can only have 50% of your capacity. I mean, this is pretty scary stuff, and it doesn't seem to play out when you look at the actual numbers.
Well, and that's what I was thinking. I mean, I'm a little frustrated. One of the things, for example, is school closures. Now,
Yeah.
what I'm looking at it, first of all, the CDC is not recommending school closures. Even the state of California is not recommending school closures. And then when you look at when the CDC talks about the guidelines for school closures, even they note that, first of all, short-term closures, like 1 to 2 weeks, are going to have little impact. Even medium-range closures, we're talking closures up to 5 weeks. Once again, they're saying will have absolutely little impact. In fact, what they're saying is that if you're going to close the schools, it's got to be 8 to 20 weeks if you really want it to have an impact on slowing the spread of the virus. But that doesn't seem to be the sort of information that policymakers are using to make some of these decisions.
Very good point. The other thing that they're not addressing when we've got these school districts closing down is that this is not a virus that's attacking young people the way, say, the SARS virus did. This one seems to be more impactful with our seniors. And so on one hand, telling people 65 and older to stay home may have, some bearing, but it's affecting our seniors who are already in poor health, people in nursing homes, or people who are already immunocompromised. So it just seems like we've got politicians taking tremendous advantage of a crisis.
Oh yeah, and there's a website, and I'll share the URL with you guys. You'll see it. You'll see it either scroll across the screen or in the description of the video. But this is a really good website that actually is doing a lot to promote and really not promote the numbers, helping you see what the numbers are. And if there's a few things that are important to note about the numbers. First and foremost, they're not telling you how many people have actually recovered. We're talking 77,000 people have already recovered. Of the 174,000 that have been diagnosed, 77,000 have already been diagnosed, gone through it, and have come out on the other side and are fine and healthy now. That's the number that most of them are not promoting. And then those who actually are still dealing with the disease, what they're also not telling you is that in over 90% of the cases, it's not serious. We're talking about people who are suffering from flu-like symptoms.
Exactly. I spent the month of February with some sort of flu. It could have been this one for all I know. And I was able to function all but 2 days. So, that's how the flu affects most people.
Well, even those in the those in the highest risk group, that's 80 years and older, 85% of them are recovering. Now, the mortality rate is about 15%, which is very, very, by the way, very, very high for an illness or a disease. So I don't want to diminish that, but understand that the likelihood of an individual actually dying of this is relatively small.
That's correct.
I think with that, once again, I'm not diminishing the idea that we need to do what we can to slow the spread of the virus. But what we're doing right now is, like you said, it seems like policymakers are going out of their way to create a hysteria in order to get people to do this. And what they're not realizing is, or maybe they are realizing, is this hysteria that they're creating is going to create a long-term effect on our economy and our society that we're going to be dealing with far beyond this virus.
Correct. And that's what troubles me about the governor's directive to bars, restaurants, brew pubs, wineries. What about movie theaters then? What about big box stores or grocery stores? I mean, people are still out there. And so some of this just really doesn't make any sense. It seems like it's very focused on the optics, looking like you're doing something about it, as opposed to actually practicing leadership and making leadership decisions. I think shutting down bars and restaurants is ridiculous.
Well, I'm kind of with you there. So what do you see as the kind of the I think there's something behind this. I don't want to say something behind this, but I believe that in particular, some of the things relating to the Brown Act, one of the things we have to be concerned about is, and if you watch the debate, the Democratic debate last night, I think you can get a piece of this, where Democrats are proposing policies that have nothing to do with COVID-19, but they're
Right.
using this crisis as a way in which to push their agenda and saying, see, this is what we need to be doing.
I agree. I think this is an opportunity, as we say, never let a crisis go to waste is the Saul Alinsky school of, government expansion. This is truly an opportunity by too many in government to expand government into control policies. And what we're seeing in California, and I've kind of noticed it's really in other blue states. It's not red states that are doing what California is doing. It's starting to feel like martial law. If the governor can announce that he's shutting down bars and brew pubs and wineries, what's next? Where do we go from here?
Well, exactly. I mean, I think some folks are concerned because they're afraid that we are looking at them potentially suspending basically locking people in their homes.
Correct.
And
Oh,
I've seen,
yeah.
I was at the grocery store on Friday. I was just going to pick up some ribs, and to see the number of people that were there buying up stuff, trying to go to the gun store to pick up ammo. It's like all the gun stores I know are completely now out of ammunition. I really believe that people are preparing for the worst. And I don't know that, once again, I don't know that we necessarily have to be prepared. I mean, part of the thing is a lot of the things that they're recommending we should be doing, quite frankly, we should have already been doing. I mean, you should have multiple weeks of food stored up at your home. You should have water and batteries and all of the stuff that you need to have, all the stuff that the average, I won't say the average prepper, but all of the stuff that you need that they say you need to have for emergencies, you should have had anyway.
Yeah. Correct.
But even with that, though, I just think that some of the steps that they are taking are creating a hysteria that are going to make it very, very difficult for us to come back from.
And that's what worries me. Again, the economic impact. And I'm going to be talking to some economists today and tomorrow about what the economic impact will be. I'm really concerned about some of these smaller businesses that are being either kind of boycotted, or bars, breweries, things like that are being told to shut down. What then? What about their employees? What about the cash flow that they need to make payroll, to pay their taxes? What's the long-term snowball effect from all of this?
Well, wouldn't be surprised to see them then use as an excuse to push something like universal income.
Yeah, you think?
I wouldn't be surprised to see that all of a sudden become universal basic income. Wouldn't be surprised to see that be pushed as a policy. We've already seen Bernie start talking about Medicare for all, which I thought Joe Biden had a great response to that. They have Medicare for all in Italy, and it ain't working so well.
Yeah, look how that's happening. Exactly.
Anyway,
I think yes, we've got the health issues to worry about, and the state has put out proper information about how to conduct yourself that way, or if you feel sick or those things, and that's good information. But again, this shutting down the state is a really scary step, and it's feeling more and more like martial law.
Right, and we all know that it would not be the first time that a government has used martial law to then turn around and infringe on the rights of citizens. One only need look at Katrina and how individuals literally lost their right to keep and bear arms, where they went door to door and confiscated people's firearms.
That's terrifying.
Exactly. That is exactly the sort of thing that we can expect a government who believes that they're protecting us from ourselves to do.
Well, and that's definitely the attitude of the governor. I mean, you listen to him and you watch him in these press conferences, and frankly, he smirked through yesterday's press conference like this is all fun and games, and he's enjoying, announcing the takeover of certain aspects of the state. It's greatly disturbing.
So, what are some of the things that from you've seen that there's just some common sense things that we need to be looking at, we need to be doing based on all the research and whatnot that you've been doing?
Well, the medical experts obviously are saying, frequently wash your hands, that kind of stuff. But I happened to catch an article by a PhD scientist level immunologist, and he said this thing's airborne. It's not on your hands. It's not, on doorknobs, and people are walking around sometimes for 3 and 4 weeks carrying it, infecting other people, not even knowing that they're infected. And a lot of people aren't even going to show signs. So, it's like any other virus. If you do start showing signs, stay home and stay away from other people.
Right. And if you do start to feel seriously ill, then contact a medical professional, then contact your hospital. Don't just show up at the emergency room.
No.
Contact them so that if they do feel like you need to come in and be tested, then you go in and get tested. Don't just assume that you need to go in and get tested. One of the biggest challenges they saw in Italy, and I think it's important for us to understand here, is it's not so much that they don't have the ability to help people get through this illness. The biggest challenge is that if everybody rushes to the hospital sick at the same time, they don't have the resources, they don't have the ventilators, the medication, or the medical health professionals enough to be able to address all of those patients' needs, plus those who are at the hospital for the number of various other reasons people wind up having to go to the hospital.
Correct. And I think the other thing that disturbs me about this mass hysteria between, our governor and politicians and the media is that this is a flu virus. It's not the Black Death. What happens if we do, or we are faced in the next few years with something far more serious? This feels like they've cried wolf. And that worries me because we're seeing you say people rushing to the hospital. That could look like people who are rushing to the store to buy up all the toilet paper. This is the mismanagement, I think, by our state government. Crying wolf is a really dangerous thing in the face of something more serious down the road.
All right, now changing this to topic kind of a little bit, but what do you think of all these people, whether it be in the media or the politicians, who are, instead of focusing on how we deal with and how we address this emergency, I call it emergency, but instead of doing that, utilize it as a way in which to bash the president? Yeah.
What concerns me is that politicians have taken advantage of trying to bash the president, when in fact, he was the one who, ahead of the World Health Organization, announced that this is a state of emergency, it's a crisis, and did things far more definitively. The travel bans, he came ahead of everybody else. And I do believe that those decisions really did help prevent a larger outbreak in the United States. So, unfortunately, it's politicians and the media just telling flat out lies.
Well, not just that, but how they were saying, well, he cut the CDC budget when in actuality they received more money. They've received more money every year over year, than they received the year before. Now, correct. Did they get as much as they wanted? No. But then again, that's kind of how budgeting works. Most entities don't get everything that they asked for, which is why generally they ask for more than they anticipate that they're going to need. Yes. But I just it's frustrating because I'm going on and I'm trying to read and follow up and see what's going on with all of this stuff, and all I see is, the Trump bashing, the president bashing, and I didn't see any of this when President Obama was dealing with H1N1. I liked how we, when 9/11 hit, everyone was like suspended, at least for a period of time.
Yes.
They suspended all of the activity, and all of the bashing pretty much slowed down or stopped while we dealt with that emergency, that crisis. And now it's like seeing it. I've just, like on social media, I've just taken to just unfollowing, unfriending, or even in some cases blocking people who are doing that, because those are not people with whom I'm interested in even trying to have an intellectual dialogue. They've just made up their minds that they're going to use, as Rahm Emanuel said, they're not going to let a good crisis go to waste.
And that's what's so disturbing to me, Craig, is that this can be dealt with in real time, using a lot of common sense, a lot of taking the advice of the medical professionals. But look at the numbers. And as I said earlier, I mean, there's 18,000 people who have died this seasonal flu season, and nobody's talking about them. Instead, we're hunkering down and acting like there's been an outbreak in every city, in all parts of the country, when this thing can be dealt with and contained properly. And it's just more of the manipulation by the media and, unfortunately, the party on the left.
Well, pretty much as we can expect them to do. Yeah. Anyway, Katy, do us a favor. Tell folks a little bit about the California Globe and where they can find your work there.
Well, thank you, Craig. California Globe is a California-centric, solid news site. We are doing a lot of the reporting that you're not getting from some of the more mainstream media outlets in California. We like to search for the truth. That's our goal. And it takes us into some pretty interesting places at times. But we're really filling a void that of honest, truthful reporting from the state capitol and about the state. And you can find us at californiaglobe.com. Check in several times a day because we're updating the website constantly.
Excellent. Katy, thank you so much. We very much appreciate you coming on. Look forward to having you on sometime, hopefully in the near future, to talk about other things that are going on here in the great state of California.
Thank you, Craig. I appreciate it.
All right. You take care.
You too.
Well, that'll be it for this episode of CRATV. I want to encourage each and every one of you, if you have any questions or concerns regarding COVID-19, or you want to follow the data, please do me a favor. Follow the links. You'll see them right here in the video. Please make sure to follow these links, or in the description of this video. Follow those links. Make sure you guys are keeping up on what is going on and the best practices of how you can keep yourself and your loved ones safe. Also want to encourage you, please make it a point, like and share this program. Tell your friends about the California Republican Assembly. We are the conscience of the Republican Party. You folks take care.